So in today's session, we'll do this presentation on obesity. If anyone is joining late, please help them out with the topic name. It's not from the textbook, it's not from the syllabus. Just for your information, just to increase your knowledge regarding the causes, symptoms, and other factors associated with certain disease conditions so that learning the diet part of it becomes easier. So obesity is commonly defined as having too much of body mass. Okay, specifically when the body mass is like fat mass. Okay, so a BMI of 30 or higher is a usual benchmark for obesity in adults. Okay, and a BMI of 40 or higher is considered severe or formerly morbid kind of obesity. Childhood obesity is also measured against the growth charts. Okay. So we will discuss about the classification of different types of obesity in the coming up slides. Okay. But morbid obesity is the old terminology. Now it is not called as morbid obesity. It is called as class 3 obesity. Okay. What is obesity? Obesity is a complex chronic disease with several causes that leads to excessive body fat and sometimes poor health. Okay. Body fat itself is not a disease, of course, but body fat, when it has 1 second. So body fat itself is not a disease condition, but when you have too much of body fat, that extra fat can change or alter certain functions within your body. Okay, it can lead to metabolic syndromes as well. Okay, so these changes are progressive. They don't happen within one day. Okay, it takes time for you to accumulate such an amount of body fat, which is going to lead to certain inflammatory reactions or metabolic syndromes. Okay, and it can worsen over time and they lead to adverse health effects. So obesity effects on body, you can see here, metabolic syndrome risk factors. It can lead to type 2 diabetes, cardiovascular diseases, fatty liver, kidney diseases, gallbladder stones, gallstones. Direct effects, it can lead to asthma, breathing difficulty, sleep apnea. You feel breathing difficulty when you're sleeping, obesity, hypoventilation syndrome. Even if you are walking a little bit or indulging in a little bit of physical activity, you get tired very easily. Okay, you get when your hyperventilation will start. Okay, osteoarthritis, back pain, gout. Okay, these are the different direct effects related to the obesity. Is obesity defined by your weight? Healthcare providers usually use body mass index. I guess you know the formula of body mass index. Okay, it is your weight divided by your height in meter square. Okay, weight in kg divided by height in meter square. That is the body mass index. So body mass index is used to define obesity in general population. The BMI measures average body weight against the average body height, As generalization, healthcare providers associate BMI of 30 or higher with obesity. Up till 30, you are considered as overweight. Above 30, you will come under the different classes of obesity. Okay. But again, BMI has its limitations, not in subjectively, you cannot use BMI to identify if somebody is overweight or not. Examples of the limitations include bodybuilders, athletes who have more muscle and who may have higher BMI scores, even though their fat levels are low. So we can't consider them obese. Even if their BMI is 31 or 32, they will not come under the obese category because they naturally have low body fat. Their muscle mass is giving them that weight. Okay. It is also possible to have. Am I audible now? So, like bodybuilders and athletes, they have more muscle mass. They may have higher BMI scores, even though their fat levels are low. So, it is also possible, on the other hand, on the other extreme, it is also possible to have obesity even if you are at a normal weight. Okay, even if your body weight is average, but your body fat percentage is high, you may have the same health risk as somebody with higher BMI. Okay, so even with a normal, like for example, 55 kg, okay, you can consider 55 to 60 kg as a normal weight for a average adult. Okay, but in that 55 to 60 kg, if your body fat percentage is much higher and you have very less lean mass, okay, or muscle mass, you will still be obese. Okay, so it's a very complex way in which you have to identify is this person obese or not. It's very subjective in nature. So what are the three different types of obesity? Healthcare providers classify obesity into class types based on how severe it is. They use BMI to do it. So if your BMI is between 25 to 29.9 kg per meter square, uh, per meter square, they put you in the weight category of class 1 obesity if your BMI is 30 to 35, class 2 if your BMI is 35 to 40, and if it is above 40, earlier it was called as morbid obesity, but if it is above 40, it is called class 3 obesity. Okay, so in general, generally these three classes of obesity are functional in healthcare. Okay, and based on these classes, different treatments are given to the obese patients to control their weight. But if your BMI is between 25 to 29.9, you are considered overweight, not obese. So worldwide, obesity has nearly tripled in the last 50 years. The rise has been especially dramatic in lower income countries where malnutrition is very common. So these communities now have a greater access to higher calorie foods with low nutritional value. Obesity now commonly coexists under the nutrition in this country. But we have seen in India as well. Comparatively, India is in the lower income country where malnutrition is also quite prevalent in urban as well as rural population. And Some communities, on the other hand, have access to higher calorie food as well. So this is seen, this complex characteristic of obesity is seen even in lower income countries. Okay. So metabolic changes, when you run out of tissues, what happens in obesity is that your body is supposed to store fat in the adipose tissue. Okay, and when you do not have any more adipose tissue to store fat, the existing adipose tissue, okay, or we call it as fat cells, adipose cells or fat cells, okay, they enlarge in size. Okay, they become larger and larger in size. Adipose tissues has this complex characteristic of enlarging itself uh, way beyond its original size. Okay, so enlarged fat cells secrete more hormones and other chemicals that produce inflammatory response within the body. Okay, on a regular basis. It does not take place. Adipose tissue will not enlarge within 1 day or 2 days. It takes months and years for you to accumulate that amount of fat cells, and then this enlarged adipose tissue and fat cells will secrete more hormones and other chemicals. Okay. So chronic inflammation has many adverse health effects as well. One way that it affects your metabolism is by contributing to insulin resistance. Okay, the first form of inflammation you can understand is that if your body is insulin resistant, you have to understand that the chronic inflammation procedure of obesity has begun in your body. Okay, and how do you identify your insulin resistance? First, you have to do your blood checkup. You are not diabetic, but your insulin levels in your blood is quite high. Okay, and you feel very lethargic. You're eating food, but you do not have energy to do things. Okay, so these things come under insulin resistance. This means your body can no longer use insulin to efficiently lower your blood glucose levels or and blood lipid levels. Okay, so because your cells are not responding to insulin, cells are resisting insulin. Okay, insulin will help create a pathway for glucose to enter into the cells. But when the cells themselves are not responding to insulin, there is no pathway created for the glucose to enter into the cells. Okay, and cells will not use insulin anymore, and then you become diabetic. And when you become diabetic, yeah, this is the pre-diabetic stage. Insulin resistance also comes under the pre-diabetic stage. High blood sugar, blood lipid, cholesterol levels, triglyceride levels also contribute to high blood pressure. Okay. So this is how the metabolic changes start. Okay. Starts with just a simple step of enlarging your adipose tissue or adipose cells or fat cells. Metabolic syndrome, type 2 diabetes. Metabolic syndrome, type 2 diabetes, obesity specifically raises the risk of type 2 diabetes sevenfold in people assigned male at birth and 12-fold in people assigned female at birth, which means women are at higher risk of developing obesity as compared to men, because naturally women have more adipose cells, more fat cells deposited in them by birth as compared to males. So the risk increases by 20% for every additional point you gain on the BMI scale. Okay, it also diminishes with weight loss. When you lose weight, your risk of obesity, type 2 diabetes also diminishes. When you gain weight, your risk for type 2 diabetes increases, specifically when you are a female. Okay. Cardiovascular disease, high blood pressure, high cholesterol, high blood sugar levels, and inflammation all are risk factors for cardiovascular diseases, including coronary artery disease, in which fat cells, okay, cholesterol will get accumulated in your coronary artery, creating blocks, creating blockages, and that leads to heart attacks, okay, congestive heart failure, heart attack, and stroke. So these risk increases the hand in it will increase hand in hand with your BMI. When your BMI is increasing, automatically understand that your risk of getting all these cardiovascular diseases is also increasing. And most of the majority of the cardiovascular diseases are preventable until and unless you are born with specific septal defect or ventricular defect. Okay, if you're born with these defects, those are separate category, but other majority of cardiovascular diseases are preventable. Then we have fatty liver disease. Excess fats that is circulating in your blood will go to your liver and and get deposited in the hepatocytes. Hepatocytes are the liver cells. Okay, so liver is supposed to filter your blood, and when the liver is filtering your blood out of these many fat molecules, so this fat will get deposited in your liver itself. Your liver will also start storing excess fat, and it will lead to liver inflammation, hepatitis. And in long term, if it is not treated on time, if the prognosis of the patient is very poor, this hepatitis will turn into liver cirrhosis, and that could be a fatal condition. Fatty liver, you have to regulate your fat, you have to control fat. Okay, medications are also given, anti-inflammatory medications are given, okay, to reduce the liver inflammation. You have to be very conscious about the fat intake that you take in diet. You have to add more phospholipids in your diet. Then kidney disease, high blood pressure, diabetes, and liver diseases are common among the most contributors of chronic kidney diseases as well. Because as I mentioned many times, your cardiovascular system and your nephrology system, okay, your urinary system, they are like twins. If something happens to one organ, automatically the other system will also start failing. If something wrong happens to your urinary system, your cardiac system will also react. Your heart will react. Your vessels will react. The same thing happens in the cardiology as well. Okay, if the cardiac system within your body is affected, automatically the urinary system will also get affected. Many of the meat, liver, okay, these are good sources of phospholipids. Even in vegetarian sources, whole grains with husk, okay, bran, rice bran, wheat bran, legumes, okay, these are good sources of phospholipids. Gallstones, higher blood cholesterol levels can cause cholesterol to accumulate in the gallbladder, leading to cholesterol gallstones. Or sometimes what happens is that when too much of fat is there in your diet, your liver will produce concentrated bile juice. And this concentrated bile juice is secreted by the liver. It stays in the gallbladder until and unless the food reaches the stomach. Okay. Only when the food reaches the stomach, gallbladder will empty the bile juice into the stomach. But what happens is that if liver is secreting concentrated bile juice, okay, these bile salts, when they are sitting in the gallbladder, resting in the gallbladder, that can form into bile stones as well in the gallbladder and leading to gallbladder stones. Reduce fat in your diet, okay. Calorie content should be reduced. Gallstones has to be surgically removed. Then direct effects, excess body fat can crowd the organs of your respiratory system, put stress and strain on your musculoskeletal system. Okay, this contributes to asthma, sleep apnea, obesity, hypoventilation syndrome, osteoarthritis, back pain, gout. This we have discussed. Okay, breathlessness comes hand in hand with obesity. When you put on weight, when you do any physical activity, and when you put on weight, automatically you will see you're breathing a lot, you become breathless, and hyperventilation starts. Okay, and when you're obese or overweight, when you sleep straight, okay, you're not able to sleep properly. You will snore. Okay, snoring issues will be there among obese and overweight patients. They usually tend to have snoring issues. That is because they are not breathing properly while sleeping. Sleep apnea means breathlessness, not able to breathe when you are sleeping at night. But daytime, when you are standing, sitting, you do not have any issues. When you're lying down, when you're sleeping, women naturally have higher fat percentage than men. And there is no such average for body fat percentage, because with respect to different age groups, your body fat percentage changes. But usually men should have around 10 to 20% of body fat, and women should have more than 20% of body fat, specifically if you are in the reproductive age group. Yes, obesity is one of the reasons of thyroid and PCOD, because in thyroid, again, obesity can lead to inflammation, lot of inflammatory responses. If this inflammatory responses is taking place in your thyroid gland, that leads to thyroid issues. Indirect effects of obesity: memory and cognition, including heightened risk of Alzheimer's and dementia; female infertility and pregnancy complications; depression, mood swings, mood disorders; certain cancers like esophageal cancers, pancreatic cancers, colorectal cancers, breast cancer, uterine cancer, ovarian cancer. Okay. So what causes obesity? Fast and convenient food, especially in communities and families where highly processed fast and convenience food are dietary staples. Usually you should see this in Western countries, where they do not have enough time to cook food. So they have access to low cost processed ready to cook items, which they should just open and microwave it, and the food is ready. Okay. So it has high calories as well. It's very easy to consume. It comes in packaged food. You just have to buy it. You don't have to cook anything. Okay. These foods are high in sugar and fat and low in fiber and other nutrients, which can leave you hungrier. And their ingredients, they whatever packaged foods are there, they do have addictive factors, specifically in terms of sugar. Sugar is a very addictive item. Okay. So majority of the packaged and processed food naturally will have sugar. So that becomes addictive in nature. Well, sugar is in everything. The food industry is not designed to maintain our health, but it is designed to sell their products. Okay. And when we become addicted to their product, we want to buy more and more of them. Okay. High on this list of products are sweets, savory, sugary drinks, which have no nutritional value, but they have a lot of added calories. Okay. So marketing and advertising, pervasive advertising pushes the processed food and sweets and sugary drinks and the products that we need at least, but the industry needs to buy from us the most. Okay. And these are most addictive kind of foods. That's the industry's marketing and advertising the most. If you open your TV, you will see lot of advertisement on Haldirams or Lay's chips, Pepsi, Coke. You can see how much they spent in marketing and advertising these drinks. Okay. The quality of the advertisement is also much higher. So that much money they're pushing into advertising these things, marketing these things. Okay. Different forms of packaged items. You can make a count of it, how many healthy options and how many unhealthy options advertisements you are seeing on a daily basis. Okay. Then psychological factors: boredom, loneliness, anxiety, depression. Okay, all are common in modern society. It can also lead to overeating. They may specifically lead to eating certain types of food that activate pleasure centers in our brain. Foods that tend to be higher in calories. Okay, they are the ones who activate the pleasure centers in our brain. Okay, like for example, if you eat one cucumber and if you eat one onion pakoda, okay, you will obviously feel more happy about eating onion pakoda, and you know what is the calorie difference between one cucumber and a onion pakoda. Okay, so that is a psychological factor, because anything that is fried and processed is naturally very good in taste. Okay, then hormones regulate our hunger and satiety signals. Okay, there is a hormone leptin and ghrelin. Okay, they control your hunger. Leptin makes you hungry. The other one makes you feel satiated. Okay, it tells you when to stop. So many things that disrupt this regulatory process of the hormone that could lead to, like for example, stress, lack of sleep, etc., and other genetic variations that could lead to making you think that you are not full. You have to eat more, more, more. Okay, stress also makes you eat more because stress is affecting your hormones. Okay, certain medications will not help you with weight loss. Leptin and ghrelin. I put it in the chat box. Please check. So certain medications that you take to treat other conditions can contribute to weight gain. For example, some seizure medications, antidepressants, steroids, diabetic medications, beta blockers. Okay, these some of them, some combinations of them cause weight gain. So, what are the factors that decrease how many calories we spend? Because when you are not able to burn a lot of calorie, that is also leading to weight gain. Okay. So, these are the factors that do not allow you to burn more calories. One is screen culture. Okay. Always looking into the mobile screen, not doing anything. Streaming media, binge watching, making long hours of sedentary and entertainment more possible. Okay. Netflix, Amazon Prime, Hotstar. Okay. Having all these things at the tip of your finger, at your fingertips. Okay, shopping also is, everything is online. You're no longer going out and buying things. Okay, you're buying everything online. Spending more time in front of computers or in phones. Then workforce changes, with industry changes trending towards automation and computers. People now do more desk jobs. They're not moving around on their feet. Okay, and also they work longer hours just sitting and not moving, doing things on their laptop or desktop. Okay, that is one of the reasons. And fatigue. Sedentary lifestyles have this snowball effect. Studies have shown that the longer you sit still, the wearier and less motivated you become. Sitting make your body stiff, contributes to aches, pains that discourage movement. So majority of the sedentary work style is leading to this kind of uh, lifestyle effect as well. The neighborhood design, many people lack local places to be active, either due to access or safety issue. Like majority of the earlier days, in evening time and all, the family members used to gather in the park. Okay, neighbors and everyone used to gather in the park, sit around, chat around, walk, do exercise, play, bring their kids to school, kids to play in the park. Nowadays, that this kind of culture is reducing, it's decreasing. Okay. Then we have childcare trends. Children spend less time playing outside than they used to. They spend more time in the childcare environment or in mobile phones, playstations, Xbox. Okay. So that physical activity is also decreasing for children. Then disability. Adults and children with physical and learning disabilities are at most risk for obesity. Physical limitations and lack of educate and specialized education and resources can also contribute to this. So coming to the management and treatment, dietary changes, you personally need to make, you have to make this choice to lose weight, and that is very individualistic. Some people may benefit from cutting portion sizes or snacks between the meals. For others, it may be more about changing what they eat than how much they eat. Almost everyone can benefit from eating more plants. Okay, fruits, vegetables, whole grains, legumes, they tend to be lower in fat, higher in fiber and micronutrients. So instead of snacking, adding these food substitutes is much better. It will make you feel fuller also and more satisfied than eating some snack. Then increased activity, just walking a moderate pace is one of the most efficient types of exercise for weight loss. Just 30 minutes of walk 5 days a week is what healthcare providers like suggest. Even if you're walking 30 minutes, just walking, okay, a walk before and after lunchtime, okay, at work. 15 minutes before lunchtime, 15 minutes after lunchtime can also make a lot of difference. Then behavioral therapies, counseling, support groups, and methods such as cognitive behavioral therapy may have a role to play in supporting your weight loss journey. These methods can help rewire your brain to support positive changes. And rarely people go for behavioral therapies for weight loss. Usually they go for nutritionists or dietitians help or gym trainers to or any other physicians to get the weight loss plan. But behavioral therapies is something that anyone would rarely choose if they are suffering from obesity. So these methods can help rewire your brain, support you to make positive changes on a daily basis. Okay. When it comes to weight loss strategy, it is about the choices that you make on a daily basis. They can also help you manage stress and address your emotional and psychological factors, and that may be working against you. For example, binge eating, okay, any eating disorders. Specifically in eating disorders, you will require behavioral therapy, the help of a behavioral therapist. It's kind of counseling. Behavioral therapy is kind of a counseling. Then medication, the healthcare provider may recommend medications to use in conjunction with other treatments. Medications are not never the answer for weight loss, but they can help tackle it from another angle. For example, appetite suppressants. Okay. So appetite suppressants naturally have this synthetic hormone ghrelin. Okay. So which makes you feel full and it does not give you hunger. So you will not eat more. Okay. So that is appetite suppressants. Only under prescription these medications has to be taken. What are the name of the medications? I'm not mentioning it here. Then we have weight loss surgery. If you have been diagnosed with class 3 obesity, in which your BMI is more than 40, in class 3 obesity, BMI more than 40, bariatric surgery may be an option. Bariatric surgery is the gastrectomy, okay? A part of the, it's a gastric bypass surgery. Okay, a part of the stomach is removed. So surgery is a severe but highly effective solution to long-term significant weight loss. So it works by changing your biology instead of just your mind or habits. Okay, both everything is required. Counseling is required even for bariatric surgery patients. Okay, so surgery, medications, counseling, everything it's a combination package that is given. Okay. So all bariatric surgery procedures alter your digestive system in some or the other way. They restrict the number of calories you consume and absorb. They also change the hormonal factors in your digestive system that affect metabolism and hunger. Okay. So when a part of your stomach is removed, the part of the stomach that is supposed to secrete leptin hormone that makes you hungry, that is also removed. Okay. So after bariatric surgery, there is a big change in your lifestyle and diet. Okay. What you were eating before the surgery is not what you can eat after surgery. Because now you have a very small restricted stomach. These are the different types of surgery. In gastric sleeve surgery, a part of your stomach is removed. Okay, that is gastric sleeve surgery. Just a segment of it is removed. And the remaining segment is sutured. So whatever you're eating, okay, will directly go into the duodenum. It will not stay in the stomach. So that is gastric sleeve surgery. In your textbook of dietetics, the image will be there. I'll show you in the next class. In gastric band surgery, they don't remove anything, but they tighten a gastric band around your upper part of the stomach so that there is a restriction in how much you can eat. Okay. They tie a band on the upper part of your stomach. Okay. So there is a natural restriction that will not allow you to eat much. Okay. Gastric bypass surgery also, stomach is cut and the end of the upper end is joined to the lower end. Okay. That is gastric bypass. And again in duodenal switch surgery, very similar to the gastric sleeve surgery, a part of your stomach is removed, but then the gallbladder, okay, whatever it secretes through the gallbladder duct is directly given into the duodenum, okay, and there is no longer supply into the stomach area. That is a duodenal switch. Gallbladder, the duct used by gallbladder to secrete the bile salts is directly given into the duodenum. And it's not that common. Duodenal switch surgery is not that common. So these are the weight loss surgery is the last option for you. Preventing obesity is easier than treating it once it has taken hold. So once your body has established a new high set point, so it will be considered as your new baseline weight. For example, since the past many years, your weight was around 60 kg. Just imagine. And in the recent 1 year, you had put on a lot of weight. You have put on around 7 or 8 kg. So now your weight is 67 or 60, 68. You're trying to lose weight. Okay. So when you have lost some weight, let's say 4 kg, you came back to 64. Now your body's new set point will be 64. Your body will not go to the old 60 kg. When you increase your weight, the newly gained weight, the average of the newly gained weight will be the new set point. Okay. So it is difficult to treat obesity once it has taken hold of. So it is better to prevent obesity. Okay. So certain steps that help preventing obesity is make small sacrifice. For example, if you have a pick me up kind of a snack or a drink, you go out, you feel low, you crave for something sugary to eat. Okay, you have a soft drink or a cold drink. Okay, so that's a pick me up kind of a snack or a drink. So avoid having that. Okay, instead of go for low calorie or no calorie drinks like having buttermilk instead of having something sweet or some fizzy drinks, carbonated drink. If you buy buttermilk, okay, that is much healthier. Or if you have unsweetened yogurt, okay, that is much healthier. So just 150 extra calories a day can add up to 10 extra pounds in a year. So it is equal to having a potato chips uh, on a daily basis, or two double stuffed Oreos on a daily basis. Okay, that this you think it is very small snack you are having, but on a daily basis when you have this, okay, it is giving you a weight gain on a yearly basis. Okay, add small activity. Consider what you may like to spend an extra 150 calories in a day. It could be brisk walking or running or taking the dog out for a walk. Okay, or playing badminton or playing your favorite sports with your family or friends just for half an hour a day. That is more than enough. Shop intentionally. Stock your home with healthy food, and don't spend money much on sweets or treats or processed food. Okay, only buy them when you have special occasions or when you go out. Cultivate overall wellness, reduce screen time, go outside and go for a walk. Okay, cultivate healthy habits on a daily basis. Avoid eating food while watching something on mobile or streaming something on TV. Okay, so these are the prevention strategies. In detail, we will study in next class of dietetics.